Hello everyone, my name is Robyn Klassen. I'm excited today to introduce to you my research, which is about discovering the dynamics of cell membrane repair in response to ultrasound-mediated drug delivery. Chemotherapy is currently one of our most important tools to treat cancerous tumors. Regrettably, however, it also comes with many side effects. These side effects occur because anti-cancer drugs end up in places in our body where they shouldn't be. As such, instead of giving pills or injections broadly to the whole body, it would be much better if these drugs could be delivered specifically to cancerous cells. We can achieve this by using a mailing system, packaging drugs up, and sending them off with a shipping label that's specific to our cancer cell. Nevertheless, the drugs still have to get past the front door, the cell membrane. This can be done by using micro or nanobubbles as packages. These bubbles, when triggered by ultrasound, explode to punch holes in the cell membrane in a process called sonoporation. Delivering drugs in this way has many potential benefits. Ultrasound is safe, accessible, and can actually see the bubbles inside the body before they're popped. However, delivering enough drug this way tends to kill cells, and while this may sound good, it can also trigger an immune response, something that would promote tumor growth or spread. So, we would prefer the cells to survive and the drug to do the job instead. To avoid dying like this, cells must repair the blast damage. One of the ways they do this is by swelling the membrane around the hole, creating blebs. However, these blebs still sometimes mean that a cell will die. So, what blebbing behaviors will keep cells alive after ultrasound treatment? This is the question I hope to answer. To discover the impact of blebbing on cell survival, I first control the size of bubbles using microfluidics. This is key because bubbles of different sizes behave differently in the same ultrasound conditions and will generate different holes. I can then punch the cells, observe the blebbing response systematically with increasing bubble size, and see whether any specific features or patterns in the blebs will predict cell death. This work is important because it allows for a deeper exploration of the cell repair response and how to improve it, helping pave the way for patient use of sonoporation. By reducing the side effects of chemotherapy, the physical maladies of patients, and the personal costs incurred as a result would be alleviated to improve their quality of life. And that is an exciting opportunity. Thank you for listening.